Hello. Hi there. I think we're on. We're back again with maybe the busiest man in Breaking Barriers this time to talk about something entirely different. It's me and it's Rahim. How are you, Rahim? Good to see you again.
Yes, very well. Thank you. Thank you for having me on again.
No worries. No worries. It was great. We're talking about something that you've done, really exciting piece of work. But before that, we are recording about 1 hour after Rishi Sunak's just delivered his budget. Now, we spoke last week about the NHS white paper, right? And it's linked to social care. Are you a bit disappointed not to see any social care in the budget at all?
Yeah, no mention of social care from Rishi today, which is a bit disappointing, given that we've been promised reform on social care and a green paper for a while, for years now. But hopefully we see something on social care soon.
Yeah, fingers crossed, right? Fingers crossed. Apparently, the entire speech was less than 50 minutes, which is relatively short, I'm told. So I'll try and take a lesson from his book and cut straight to the chase. You've put together a new report, right? Called Healthier Environments, Healthier Populations. What is it? Explain a little bit about its content and why you wanted to conduct that research.
Yeah, so the main driver for me wanting to conduct actually stems from a book I read by David Wallace Wells, which is called The Uninhabitable Earth. And I think there's a shared feeling among many, particularly people my age, that climate change is a problem, but that the consequences for population and individual health are still decades away, and it's something to worry about in 2050 or later. But reading this book really put that notion to bed for me. It's something that we're dealing with right now, and the consequences of it are being felt right now by a number of different communities.
Yeah, so you talk about immediate threats there. We need to be paying attention to this. What are some of the threats posed?
Yeah, so in the UK, we've seen increased incidences of flooding, storm damage, and extreme heat all across the country, with consequences for health. For example, there's more than double the number of heat-related deaths among those over the age of 65 in the last 20 years. There's significant mental health and trauma impact. So those who experience storms or flooding are 50% more likely to suffer from mental health problems. I haven't even mentioned the biggest and most alarming threat, which is air pollution, which poses short and long-term threats throughout the life course, and it's attributed to with tens of thousands of deaths in the UK annually. And this issue is made all the more urgent as because concrete links are now being drawn between air quality and increased COVID-19 related deaths in England and abroad. So where you have pockets where there is poor air quality, we're seeing increased deaths. So this issue is becoming more and more urgent to address.
Yeah, sure, absolutely. Wow. Well, you're clearly passionate about this agenda. You've mentioned that you read that book as well that inspired this bit of research, but just talk us through how you went about gathering this evidence. Did you speak to specific people?
Yeah, so it was a combination of desktop research, as well as a number of interviews with senior leaders in central and local government, as well as the NHS. Really, because this report was an attempt to scope current and potential local approaches to tackle climate change to improve health outcomes, really, is the end goal of what we were trying to scope out. So we were also lucky to speak with leading academics from LSE and Imperial College's Grantham Research Institute,
Brilliant.
as well as the London School of Hygiene and Tropical Medicine's Centre on Climate Change and Planetary Health. So we were keen to get a diverse range of views to understand more about environmental challenges to population health and economic growth as well as understanding the barriers preventing implementation of activity and get an idea of some creative ideas of what might accelerate positive change.
Right. Yeah. No. That for me is the massive thing here. So you've gone out and you've spoken to a really broad range of stakeholders: NHS, local authorities, central government, and academia. You mentioned. I'm sure they all brought, your attention to the problem that this is creating. But finding robust solutions, that's the real challenge, right? And looking through your report, you emphasise doing that at a place-based level. When we're talking about environmental change in health, what does a place-based level mean?
Yeah, so health outcomes are not caused by a single issue, but by a complex mix of environmental and social factors which play out in local areas, in places. And place-based approaches recognize that to make a significant change to health outcomes at a population level, it's necessary to address wider determinants of health and to consider the impact of psychosocial and protective factors. So climate change affects social and environmental determinants of health. Think about clean water, clean air, sufficient food. So place-based approaches to tackle climate change can analyze local vulnerable populations and provide more of an understanding of how and why people are behaving, responding to climate risks, how they've responded in the past and how they're responding in the present. But the real challenge here is that we know climate change's effects vary across continents, cities, towns, and even neighborhoods.
Sure.
And so when you're thinking about a place-based approach, there's a complex challenge here, because if, for example, if we think about an area having a high level of air pollution, local government and local communities may take action to tackle that high level of air pollution in that area, but they can't really account for what neighboring areas do.
Sure.
And their pollution there might be affecting them. And in fact, we know that in some parts of southern England, air pollution is blown in from continental Europe.
Right.
And so the costs and benefits of implementing local measures are not necessarily felt in the areas where those measures stem from. So this is the real challenge with coming up with place-based solutions for climate change and the effects it has. But I think it's a challenge that if it's going to be addressed, will have to be addressed through effective partnership working.
Yeah.
So being able to work across communities, across neighborhoods, to come together and really implement positive changes.
Yeah, absolutely. I just want to press on solutions a little bit there, because I don't know about you, but when I hear about climate change, environmental crisis, whatever it's called, I'm kind of thinking of huge multinational corporations or massive nation states, and it feels almost out of our control. What can local authorities or central government or NHS or any of the stakeholders that you spoke to, what can they do, and what are some of the barriers to them implementing effective action?
Yeah, so obviously there's a huge responsibility on the private sector and on the international community to lay the groundwork for major global changes to tackle climate change. But through our interviews, we learned about examples of grassroots innovation and really positive work being done by local government that's making a difference. So I'll run through a couple of examples. Birmingham's Clean Air Zone, which is being introduced to tackle levels of nitrogen dioxide, and that's a really positive change, but it's also come with consultation with local communities about air pollution and the benefits of green spaces. So not just an implementation of a clean air zone, but also reaching out to local communities to improve understanding about why it's being done and the impacts, the positive impacts it's going to have on population health. We also learned about different local councils exploring apps for carbon transport so that people can map out their use of carbon transport, which is pretty innovative in that people might not know how much carbon they're emitting from their daily travel patterns. So stuff like that. We also heard about a council that has a public health behavioral science team, which I thought was quite interesting. In that behavioral science team is working with transport colleagues to get people walking and biking in a county where there's a heavy reliance on cars. So being able to understand how behavioral change might happen when it comes to climate change will obviously be huge. So that level of activity from local governments is there, and that commitment is there, and that will have meaningful positive impacts on local populations.
Yeah.
You talk about barriers. Obviously, the biggest barrier is going to be funding.
Right.
Effective solutions can't be achieved without commitments of major long-term funding from central government. But there is growing hope that with the new green industrial revolution that's been promised, that there will be more funding pots available.
Yeah, absolutely. I mean, we spoke at the top of this session with fresh off the budget. I know sort of green investment, green economy was mentioned a little bit there. So, watch this space on that front. Behavioural change you mentioned as well. Fascinated by that. We know it's not just a case of education. You can shout at people that this is bad until you're blue in the face or green in the face. It's often not enough. Now, one of the really interesting solutions that you raised there, Rahim, was apps. I can't remember where you mentioned it, but you're talking about some stakeholders bringing in apps to measure their carbon footprint. Now, that relies on a phone, on a smartphone. It relies on a relatively strong, digital literacy skills amongst you. Inequalities was a big thing that came out in this report of yours. Not everyone has a smartphone. Not everybody has the digital literacy required. When you're thinking of solutions, again, through that lens, how big of a problem are inequalities in the climate change agenda?
Yeah, huge. And it's a huge problem that's being swept under the carpet, if you like. It's not being thought about enough. So you talk about digital technology, and I mentioned earlier about mapping your carbon footprint with regards to transport. But you can't ask deprived communities, deprived families to give up their car that takes them to and from work every day, without which they wouldn't have an income if they're not able to drive their car to work every day. So things like that are not being thought about enough. And you talk about technology. We've seen with the pandemic that there's been a lot of innovation around the use of digital technology. And it's a great opportunity for inclusive communication about climate change. But there are risks that gaps are growing for people who don't have that access to technology. And it's particularly interesting because we know that climate change is having a disproportionate impact on deprived communities. So in London, almost half of disadvantaged communities suffered pollution levels above EU limits, compared with just 2% in wealthiest communities in London. Wow. And also there's data from City Hall that shows that the average nitrogen dioxide concentration in the most deprived areas of London is 24% higher than the least deprived. And those are obviously areas with the highest number of mixed or multiple ethnic groups. And yeah, as I said, we can't demand that these communities make drastic changes to their everyday lives. So it's vital that these vulnerable communities are provided with incentives to make changes towards healthier environmental choices, so that they're more desirable, not something that they're forced into do. And a big worry is that people in deprived or BAME communities tend to be left out of these conversations about how these incentives might be designed. So there's little evidence that people from the BAME community are engaging with mainstream debates about health outcomes from climate change. And it's going to be near impossible to understand what will incentivize behavioral change without actively involving communities in designing schemes to make environmentally healthier choices.
Just let me kind of summarize that answer. So I asked you a question on inequalities, how bad a problem is inequalities, and what I'm hearing is these have real world consequences. You know, the statistics you've given, they're not just letters on a page, they have real world health consequences. We need to provide incentives for change, but that's hard because we're not sure what those incentives might be. But a way to find that out is proper, robust, genuine commitment to co-production.
Yeah, exactly right.
Fantastic. I get it. And I think you and I have done pretty well. We've spoken for about 15 minutes and we've not yet mentioned COVID. There can't be many conversations in the last 12 months that have hit that record. But we can't not talk about it. So just briefly, kind of, you know, how has COVID, how has the pandemic changed the environmental agenda?
Yeah, so I think we've seen both positive and negative impacts of COVID on the climate change agenda. Obviously, the pandemic is dominating almost all of national and local government's time and capacity, and that has pushed out other important activities, including climate change, to the fringe. And we've also seen that more people staying at home during the winter months has meant the danger of fuel poverty has become more acute due to increases in home working. So there have been negative consequences, but we've also seen a surge in walking and cycling, and a growing recognition of the importance in terms of the benefits of that to our health, and also increased use of local green public spaces. But I think crucially, the pandemic has accelerated the visibility and importance of the green agenda, which is now being seen as one of the keys to economic recovery and the creation of new jobs around, particularly around the renewable sector. So we've heard about Boris Johnson's £12 billion plan for a green industrial revolution. But I think another thing that's happened is that we've seen a rapid pace of change with COVID, and we've seen that is possible, where when there's a critical danger to population health, suddenly a rapid pace of change is possible. And that's not something that we've seen so far with climate change. We've seen a lot of slow, gradual movements. And I think this is the first time that we've seen such a rapid pace of change in a number of decades. So that unprecedented speed to enforce lockdowns and roll out vaccines, imagine if that's directed towards climate change, there will be a number of positive benefits that we'll see if that comes to pass.
I think that's absolutely right. And, you know, it's not just the kind of the speed in which government has been able to respond. I think the speed in which the population writ large has demonstrated a capability to change its behaviour quite drastically. That's something that we've seen during the pandemic. You talked about people maximizing green spaces. That really resonated with me. I mean, I don't know about you, but deep into kind of lockdown, particularly over summer last year, I found that just going for a walk, 20-30 minute walk was unbelievably kind of good for my health, physical and mental. It's almost the cheapest health supplement on the market. Just get out and enjoy the green space.
Yeah.
It was great.
And suddenly you find yourself knowing a local area better than you've ever known it before. Which is great as well.
Yeah, absolutely. You become a bit of an expert in that. So the report's called Healthier Environments, Healthier Populations. What's happening to it next? What would you like to see come out of this?
So I think one of the major takeaways from the report is what we've learned about inequalities.
Yeah.
And given previous work that BBI has been able to do around community engagement and engaging with hard to reach population groups, I think we are keen to carry out community engagement exercises that would serve to improve understanding about climate change's impact on population health, but also actively encourage engagement with the climate change agenda from these populations, so that they can be at the forefront of leading this agenda in the future.
Yeah, I agree. I think that approach, you completely, genuinely embed community engagement. You have total purity of intention. You want to get their voices because they're the kind of people who are going to be living in these environments, hopefully living a really healthy and prosperous life as well. Rahim, thank you so much. I'm really looking forward to pushing this report. I know you've put an awful lot of work into it. You've spoken to dozens, if not more, of people from across the landscape. I'm sure you're really grateful for their time, and you thank them in the report. When it's out, I'd encourage everybody to read it, whether you're interested in the environment, in health, in social care, in inequalities, whether you want to know what impact the pandemic has had. It's well worth a look.
Yeah, and it's not too long either. It's one of our shorter ones, under 12 pages, which is a record, I think.
You can't say fairer than that, can you? That's fantastic. Look, thanks for joining me again. 2 videos in 2 weeks. That's almost a bit of a trend. Although I noticed this time you're not wearing a tie, but I'll let you on.
Yeah, I had to dress down a bit for this one.
I like it. Good stuff. Thanks so much. I'm sure we'll speak soon. Thanks, Rahim.
Thanks, George.
Cheers. Bye-bye.